Patrick, so great to have you on the podcast. How are you today?
I really appreciate you having me on.
Let's dive right in. So we tend to keep these relatively short and sweet, but very informative. Let's start off with first time you being on the show. Tell the audience a little bit about yourself, and then give us a quick overview of Sidecar Health.
I am an engineer by training, so I'm a mechanical material engineer. I don't traditionally have a healthcare background. Sidecar Health is a healthcare company, which we'll spend a lot of time talking about. But things to know about me is I'm always a problem solver, always approaching things from like, hey, how can we do the best around this particular problem? And for me, around Sidecar Health, something important to know about me is I've got 3 kids. I don't know if you have any kids, but healthcare starts to become really important as you as you have kids and you start going through the system. And a lot of what Sidecar Health is came from my own family's journey with healthcare struggles with my family. And aside from being an engineer and a dad, also a serial entrepreneur, this is the 3rd company that I had the privilege of building. All my companies have been consumer focused, so I'm absolutely a consumer kind of technology background guy, and everything that we do, and everything I like to get excited about are around like, how do you empower consumers? And so hopefully that gives you a little bit of context.
What is it about, you said you like to start these consumer focused businesses. Everyone I've talked with, right? Usually you pick a side. Very, very few people have said, I'm going to go back and forth between, selling to enterprises and then selling to consumers. What is it about consumers that has just been something you've been so comfortable with to start multiple businesses that focus on them?
I think consumers are incredible because they have this unbelievable power to find the highest value at the best price, right? It's the market force associated with consumers. Consumers are also understandable. Like, they make decisions in a very pure way. And so if you can develop a product that actually works for consumers, it's not that there aren't enterprise applications. Like our business, like as you know, Sidecar Health is a major medical health insurance company that serves large employers. But so we have both clients, right? So we have the enterprise, of course, but at the end of the day, the people using our product are consumers. And so what gets me excited is how do you design a product that actually works for people? And then the applications are, you're sure to have the biggest impact with enterprise if you can build something that works for the people that use it.
Now, what would be your advice for, I hear from a lot of entrepreneurs that have always been just kind of on the B2B side and then want to go to consumers, some out of general curiosity, some because they've come across, a real problem that they're hearing from consumers. Is it possible to make the switch? Like, what is, obviously you're super comfortable in this space, but do you have any advice for them? I just want to ask you that and we can talk more about Sidecar, but I have been getting that question a lot.
Yeah, I mean, from my perspective, it's all about the customer journey. Like really thinking about what is the customer that's using my product? What are they doing? What are they trying to accomplish? How do we remove the friction from those processes? So if you're in working in enterprise and you are in a role where you're thinking about how people are using your product, if there's a lot of applications for that, if you can take that thought process and you can apply it to consumer and vice versa. If you're working on an application that is not thinking about the interaction of a user, I think the transition is going to be hard.
Makes sense. And I would also probably say, like, for those that are making the switch, just making sure they have the right advisors and support system of people that probably have. Yeah.
Yeah. Yeah. When we built Sidecar Health, when we were trying to choose our initial investors, so we're venture backed and have great investors. I always kind of think about it from like, who is the person that's going to be around the table and what additional perspective are they going to have that we don't already have around the table? And like hopefully like every entrepreneur, I kind of think about my own gaps. Like, hey, what don't I know? All right, so I need to go find someone that knows that and find someone that knows this.
Oh, gone are the days too of certain firms that were just like, here's the capital. Like they need to bring something because the capital is there, right? They need to bring something else to the table or they're not going to be your investor.
Right. I mean, again, I can't speak for everybody, but we've been very fortunate and it's been easy for us to raise money. What's been important is what you said is like, how do you pick the person that is going to add value in the mission and the journey that you're on?
Yeah, that's from like first time founders. Always what I hear from them is they think that the investor picks them, but they have to pick the investor too. The wrong investors can ruin them.
Yeah, I'd like to think, and my investors will appreciate this, is that I always pick. I talk about belly buttons, right? Like I want to make sure I got the right belly button around the table. Like I'm interested in people, not brands. It's great if you worked for you're working from a storied firm, and we have many storied firms in our cap table, but we also have firms that you may not know of, because the individuals are so valuable to what we are trying to accomplish. And we're a mission driven company that thinks that we can literally fix the US healthcare system. And so I wanted to make sure you had the right people on that journey. And that become a big, so that I would give that advice to first time entrepreneurs. Don't chase valuation, don't chase terms, chase people.
Yeah, well, also sometimes some of the biggest brand, assuming like the person's like personal brand, sometimes, not all the time, when it's behind the curtain, they're actually not the most knowledgeable around. They were just the most out there. Now this can change, right? But I agree with you entirely. Yeah. Would love to hear your thoughts, right? Of okay, so you started Sidecar Health. This is not your first rodeo. You've been doing it. It's just it's so great talking to serial entrepreneurs because like there is that confidence of like, listen, there's things that could definitely go wrong that we'll be looking out for. But if we continue to execute, we believe that we're going to be, reach our mission. Talk me through the problem of denial rates in traditional insurance. Give our audience a little bit more of a, I guess, a primer on that for those that are unaware.
Yeah, absolutely. And you're right. Serial entrepreneurs, it's always fun to talk to because they have lots of perspective. I like to joke that I used to have hair. At some point
That's
I
what I
did,
was.
but it's been a long time. What I will say is this is the last thing I'm ever gonna do. Right. I wake up every day. This is a mission it's very fulfilling. We're having a massive impact, and it's something that I know that I'm going to be able to be on for the next 20 years. Like, how do you go fix the US healthcare system? Warren Buffett refers to it as a tapeworm that's insurmountable. I could not disagree more, right? That you actually can. And you bring up denial rates. So maybe the first thing to do is to make sure that everybody kind of understands what we are and how we are different. And that would hopefully kind of allow us to talk about why denial rates is a big piece of how we're.
Talk me through, why putting consumers and doctors in control of healthcare decisions and not insurance companies is the right.
So Sidecar Health, again, is a major medical health insurance company focused on employers. What does that mean? So everybody's heard of United and Aetna and Anthem and the Blues. So we're like that. We're a full stack health insurance carrier. We serve large employers. For us, our smallest employer is a 51 person electrician group. Our largest employer is a 60,000 employee, Fortune 100 company. So the gamut of healthcare. So what makes us different? You mentioned, right? So denial rates. There's lots of conversations about denial rates, people getting denied access to care. So our whole mission and what makes us special is that we eliminate barriers to accessing care. I think Kaiser Family Foundation came out I think 2 years ago. It's been resurfaced given all the trouble United's been having, talking about how for a traditional network-based health plan that you've probably been on and so many people are on, the average denial rate for claims within network is 19%. Like for me and my family, that's not okay. And if it's helpful, I can come talk about my family's journey. But like, so our denial rates are less than 1%. And last year, like dramatically less than 1%. And that's important because when you're engaging the healthcare system, you want to make sure you're getting care. And I don't think it's office visits that the traditional health insurance companies are denying, right? It's the things that you really need. It's the cancer treatments. It's ending up in this never-ending kind of journey of prior authorization, a word that maybe most folks have never heard, but you need to get authorization to get care by your insurance company before your doctor can actually do what they say they need to do to keep you healthy. So what makes us different than every other health insurance company is this concept of empowering doctors, and this is where you're going, to make care decisions. And we view our job as to pay for it, right? To remove the barriers to care, no step therapy, no formularies, no networks. We want you to choose what doctor to go to and have the confidence that the doctor's care path that they outline for you is going to be available to you. So that's our main thing, which I imagine sounds wonderful. Who wouldn't want to be on a plan that doesn't have barriers to care? The question that we usually get is, how do you make that work? Yeah. So our whole thing, and this gets back to my journey, right? Like, is about the consumer, right? So the whole U.S. healthcare system is based. And if you think about your own personal experience, like it's frustrating working with traditional insurance companies and the traditional insurance. Like, how do I get access? I need approvals. I have these deductibles, more and more costs. Basically, we're reducing access, we're reducing coverage, is how the traditional system works because costs are getting wildly out of control. We have a different perspective. We believe that to control costs in the US healthcare system, all you need to do is provide transparency, let people know what things cost, and then reason to care. You can put those things together. And that's what we do. What we do is when we partner up with an employer and we enter into a particular location, we basically say, hey, there's 170,000 things you can do in the US healthcare system. So in your area, so let's take Tampa, St. Pete. We'll basically go in and say, hey, what does a knee replacement cost in Tampa, St. Pete? What does an office visit cost? An MRI? What is the average commercial rate? And we'll we'll set our benefits to that average. And then we tell that to consumers through an app. Basically, we basically give people the information they need to make care decisions through an app. Say, hey, here's what local pricing is. Here's what your benefits are. They're set to the average, and you can go wherever you want. And then we give them a Visa card that enables them to pay doctors directly that they choose with our money. It's not a credit card, it's a delivery mechanism for cash. So suddenly, you have an empowered consumer for the first time in the US healthcare system, one that knows that a lower back MRI with contrast costs like on average $700. And so if a local hospital decides to charge $3,000, right, they know that they're getting charged too much. And likewise, if there's a local place that's charging $300, like, wow, that's a great price. And how we introduce, that's the transparency piece. And how we introduce motivation is we're going to give you that $700. And if you decide to pay more than $700, that's fine. That's your choice. But you know ahead of time you're responsible for that. But if you decide to go to a place that costs less, you get to keep half of that cash. And so that becomes an aha moment for consumers because they don't realize that there's wildly different prices in the US healthcare system, and they're not related to quality. And so suddenly our members, like our average member gets $1,000 cash back a year because they are engaged in their healthcare process. They see quality scores, they see pricing, and they make decisions. And so that's how we enable doctors to make care decisions, our members to actually engage, and that's what makes us different.
I'm trying to think back. Do you ever leave like flyers or anything at a conference anywhere?
No, certainly not intentionally, Jared.
I'm trying to see if I can find. I can't find it. It's I've heard of obviously Sidecar before having you on here. I have to think back. I'm gonna go look through some notes after. Um, when you look at obviously price transparency is so important. You know how let's like how do you take feedback? This is a question I love to ask guests. Like how do you take feedback from consumers and actually decide what gets implemented and what you know?
So we get feedback from consumers all the time. This is one of the things that when we built our team, going back to where we started our conversation, it's like half of our team are consumer people, half of our team are deep healthcare people because we need both. And I think that's one of the issues in the healthcare space is that you don't have both. So let's talk about feedback. When we were initially starting out with our products, like we're all about full transparency. Like you know what your benefits are. You get to see. We talk to people about how you get pricing from doctors so you can make good decisions and off you go. And we basically release consumers to the wild where they're suddenly in charge of their journey, just like they are for every other thing they do with consumers, right? So you go shopping for groceries, you know what the prices are before you check out. You need to go get a home project done, you know how to get a quote, you ask for multiple quotes. So we put that process on consumers. Well, we got feedback from folks early on that, hey, wow, that's great, but I'm not sure I'm ready to ask my doctor what things cost, right? So our whole model is about empowering consumers to know pricing and make decisions with knowledge of cost before getting care. But some people want an on-ramp to a change in how healthcare works. So that was feedback from our consumers. So what did we do? We introduced this concept of a pre-check providers. So when we go into a given area, we identify hospital systems that we set our benefits to. So if you're not comfortable yet asking your doctor what things cost, that's okay. We're going to tell you which hospitals in your area are going to be below your benefit amount. So you can just go to that cardiologist or that MRI group or that pediatrician, etc. And you know that your benefits are always going to be above what they charge. And so that's an example of consumers going, wow, I love this, but I want to take it in steps. So maybe I'll just start kind of asking the price and then paying it, but I know ahead of time that the price is going to be below the benefit amount. And then as I get smarter, maybe I start shopping around with pharmacy because people might know that CVS and Walgreens might be dramatically more expensive than Kroger or Publix. And so that's an easy thing for people to see and get an on-ramp. So there's an example of where you take feedback and you kind of really try to meet consumers where they are.
What's next for Sidecar Health, Patrick?
Well, we're really proud that we've been the fastest growing employer plan in all the markets that we've been in. So we launched in Ohio. Then last year we launched Georgia. This year we just launched in Florida. So that's been going really, really well. So our goal there is to continue to grow in those states. The other thing that we're doing is last year we started our conversation talking about getting the right investors. So last year we were doing our Series D, and actually we ended up choosing Koch Industries, Georgia Pacific, their parent company, to lead our round. Why that was really important is we never set out to do that, but you meet people and they're just ideologically so well fit. They think about how do you use free markets to influence healthcare. And so we're obviously free market healthcare. And why that's important is they actually came to us and said, okay, well, we want to roll this out with our folks. And so we rolled out with them, and that caused us a lot of excitement in the jumbo space, where more and more very large employers are coming to us saying, "Hey, how can we roll Sidecar Health out to our company?" So the other thing that we're doing that's new is this was the first year. Next year we're adding more. Is serving jumbo accounts. The largest companies in the United States. So that's been really fun for us. We just hired a president to lead that business for us that we're really excited about. So those two things, like growing within the three states where we are, and then starting to serve jumbos.
I love it. I love it.
Yeah.
Well, I'm super excited, Patrick, for you and the team, and definitely want to have you come back on again in the near future. We can catch up. We can have you on a different show, talk about some stuff, but really appreciate you being on.
Well, hey, thanks so much for taking the time and for the interest in Sidecar Health.
Absolutely. Thanks so much.